Canada spends over $331 billion annually on healthcare. That's roughly 12% of GDP. Yet chronic disease and mental health burden continue rising. Healthcare does not lack software. It lacks execution between encounters. We are introducing execution infrastructure into Canada and looking for a national strategic partners to deploy it. Nearly 88% of deaths in Canada are linked to chronic disease. Diabetes affects close to 1 in 10 Canadians. Mental illness costs about $50 billion annually. Care plans exist. Execution collapses in daily life. That collapse is economically material. Hospitals discharge successfully. Doctors prescribe correctly. Insurers reimburse properly. But no one owns daily adherence. No one enforces diagnostic rhythm. No one monitors lifestyle drift continuously. That gap compounds year after year. Most digital tools inform and notify. They do not enforce. Briea operates differently. It initiates engagement, reinforces behavior, tracks completion, escalates when risk persists. This is infrastructure, not engagement software. 5 differentiators: proactive architecture, not passive, true omnichannel parity voice, app, messaging, multilingual by design, critical and bilingual Canada, full-spectrum health integration, execution confirmation logic, not reminders. This combination creates structural advantage. Agentic AI detects missed medication, declining engagement, delayed diagnostics. Generative AI adapts tone, guidance, and progression. This is orchestration, not chatbot functionality. It scales continuity without scaling payroll. Canada's publicly funded system with supplemental private coverage still faces the same issue: behavioral drift. Execution infrastructure supports hospitals, insurers, employers, universities, public programs. Stabilized behavior reduces escalation in every model. Canada has strong digital penetration and a population exceeding 40 million. Adoption friction kills digital pilots. Voice and messaging reduce friction. Lower friction equals longer retention. Longer retention equals measurable behavioral stability. Canada is officially bilingual and highly multicultural. Engagement in preferred language increases adherence. Adherence increases completion. Completion improves outcomes. Language alignment is strategic penetration leverage. Chronic disease drives the majority of mortality. Diabetes alone affects 9 to 10% of Canadians. Chronic escalation happens gradually: missed medication, skipped lab, delayed follow-up. Infrastructure restores discipline at scale. Mental illness costs Canada $50 billion annually. Most of that cost is productivity loss, not hospitalization. Continuous low-friction monitoring prevents crisis escalation. Prevention is cheaper than intervention and more scalable. Discharge is the highest risk moment. Without structured continuity, medication lapses. Appointments are missed. Early deterioration goes unnoticed. We convert discharge into a 12-month pathway without hiring additional coordinators. Consider an insurer covering 200,000 members. If 8% are diabetic, 16,000 members. If poor control adds just $1,000 annually in avoidable cost, that's $16 million exposure. Stabilize even 10%? That's meaningful actuarial impact. Canada has telehealth, fitness apps, trackers, and portals. But those are tools. They don't own daily execution. Healthcare fails in follow-through, not access. Briea operates at the infrastructure layer, owning proactive, longitudinal engagement. Infrastructure is difficult to replace. That's the strategic difference. The designated Canadian partner gains first-mover infrastructure leadership, multi-vertical deployment, hospitals, insurers, employers, government, universities, white-label flexibility, recurring subscription economics, cross-sector upsell, high switching costs once embedded. This is not software distribution. It is introducing execution infrastructure into the Canadian healthcare system. Revenue in Canada scales across multiple monetization layers: per member insurer licensing, per patient hospital deployment, per employee enterprise subscription, provincial health collaborations, university campus licensing, one infrastructure, multiple revenue channels. Because the architecture is horizontal, growth compounds across verticals. Scale is not linear. Scale becomes structural. Healthcare spending is rising. The population is aging. Mental health costs are accelerating. Workforce capacity is under strain. Canada is digitally mature. The pressure is systemic. The environment is ready. The next evolution is not another app. It is execution infrastructure. Canada will continue spending hundreds of billions on healthcare. Chronic disease and mental health will remain the dominant burden. That trajectory is fixed. The only variable is execution between encounters. Will it remain unmanaged? Or will it become national infrastructure? That is the strategic decision. We are looking for structured national Canadian partner. The profile is precise: health IT integration leadership, provincial institutional access, insurance technology capability, public sector procurement navigation, enterprise-grade sales infrastructure. This is not a reseller relationship. This is infrastructure-scale collaboration. Execution infrastructure compounds across the system: hospitals, insurers, employers, government, universities. Each deployment strengthens the ecosystem. As integration deepens, switching costs rise. Over time, position becomes structural, not competitive. That is how durable market control is built. Healthcare spending will not decline. Without execution continuity, escalation continues. Briea is proactive, multilingual, omnichannel, AI-orchestrated infrastructure, ready for national deployment. We are looking for partners in Canada to introduce this category. If you are prepared to lead structural change, talk to us. Let's start a new national healthcare journey together.